This is going home after total knee or total hip surgery. Deciding on your personal goals is an important thing to do before your surgery. Everyone has different things that they've given up because of their pain and disability, and everyone has different goals to achieve after their recovery is complete. It's important to think about what those are and to write those down and think about them often as you're recovering. Nutrition is very important to your healing after surgery. You might be a little dehydrated after surgery, so drinking lots of water is very important. Remember to focus on proteins, vitamins and minerals like calcium with D, zinc, vitamin C, and iron. Fresh fruits and vegetables and lean meats are an important part of your diet. Constipation can be a result of the surgery and some of the medications given to you during the surgery and after. It is important to stay hydrated, avoid caffeine and alcohol, drink 8 to 10 glasses of water, sometimes more, sometimes less. It's important to drink more than you usually drink. Focus on those high fiber foods, fresh fruits and vegetables. Avoid artificial fibers like Metamucil and Fibercon unless you already take those and are used to taking them. You should take stool softeners like Colace. You should take a laxative like Senna, and you may need other medications like Milk of Magnesia and Miralax. It's important that you take these laxatives at the first signs of constipation. Anything over the counter is okay to take. Frequent movement is important, hourly walking, and avoiding opioids unless necessary to keep you moving after surgery. When getting ready for surgery, it's important to make sure you know which medications you're to stop for surgery, when to stop them. And it's also important to know which ones you have to take the morning of surgery with a small sip of water. You will be asked to shower with a special soap that's going to help decolonize your body or remove bacteria from your skin from the neck down. Follow the instructions about stopping eating and drinking the night before. Typically, it's no eating or drinking after midnight except for a small sip of water with your medications in the morning. Do not wear any lotions or makeup, do not wear jewelry, and leave your valuables at home. When you arrive for surgery, the nurse will start an IV. The surgeon will come to greet you and mark the surgical site with a special marker that's safe to use on your skin. After surgery, you will be monitored by the staff. They may check your blood pressure, they may check your oxygen level, and they will ask you about your pain. The surgeon will call your family member after the surgery. You'll get up, you'll walk, you'll eat, you'll go to the bathroom, you'll work with physical therapy. After you've worked with physical therapy, your surgeon will write your prescriptions and your instructions. The nurse will review all of those and make sure that you have the prescriptions that you need to go home. Typically, your incision will be glued closed. The glue will fall off when it's done doing its job. That typically happens sometime after the second week. A Mepilex dressing is applied. That's a long, sticky Band-Aid type dressing. It stays on for anywhere from 2 to 4 weeks after the surgery, and your surgeon will make sure to order how long it's going to stay on. The nurse will review how to use the bandage and for how long, and make sure that you go home with enough bandages. The Mepilex bandage is worn for 1 week, removed, and a new one is replaced. So they're good for 1 week. You can shower after you have your Mepilex dressing on. I do recommend running your fingers along the edge of the bandage to make sure it's sealed before you get in the shower. Once you get in the shower, you can let the water roll off of the bandage and pat it dry when you get out. You cannot put any lotions, creams, or oils, and you cannot submerge your incision in a pool or a tub for at least 6 weeks after surgery. If you notice drainage coming from your incision, soaking your bandage, coming out from under your bandage, if your incision is still open after your bandage is due to be removed, you should call the office and let someone know. You will need a walker and a cane after surgery. The walker should have the wheels on the front and the rubber stoppers on the back. You should acquire them before you come in for the surgery. You do not need to bring them into the surgery, but you should have them in the trunk of the car for your discharge to home. You can borrow them from friends or family members or lending closets or senior centers, or you can purchase them. It is important to make sure that you keep moving after surgery. During the day, you should get up and walk a short distance every hour. Hourly walking is important to prevent complications that can happen in your lungs and your belly. It prevents blood clots and it prevents scar tissue from forming. If you've had a total hip replacement, this walking program and some exercises that you'll learn after surgery are important to keep up until your follow-up visit. If you've had a total knee replacement, it's important to work with a physical therapist for several weeks after surgery. Total knee replacement patients will go to outpatient therapy 2 to 3 times a week for 4 to 6 weeks to achieve their goals. It's important if you're having a total knee replacement to let your navigator or scheduler know what outpatient clinic you'd like to choose so that the orders can be sent prior to surgery. It's important that you schedule those appointments starting 3 to 4 days after your surgery date. Complications like blood clots can be prevented with frequent walking and blood thinning medication. Most of the time, people take aspirin 81 milligrams twice a day for 4 weeks, unless you are already on an anticoagulant. If you have swelling, pain, redness in the calf, you should call your doctor's office. Infection is also important to prevent with antibiotics, hand hygiene, and keeping your incision covered. Do not touch your incision, don't soak your incision, wash your hands before you change your dressing. If you have redness, swelling, pain, or heat that does not decrease after surgery or fever above 102, or increasing drainage from the incision, it's important to call your surgeon's office. If you have any chest pain or difficulty breathing, seek care immediately.
This presentation is designed to help you with exercises before and after your total hip replacement or total knee replacement. The objectives of this presentation are to help you prepare for surgery. We will provide you with exercises and teach you about the different assistive devices that you might be using, such as walkers or canes. We will also discuss the keys to rehabilitation after surgery through exercise, activity. We'll suggest what kinds and how much, and we'll answer some common questions such as overdoing it. Preparing for surgery. Exercises are designed to help improve the flexibility and strength of your leg prior to surgery. It is beneficial to practice the exercises before surgery that you will need to perform after surgery. The stronger you are before surgery, the better your outcome will be after surgery. Key factors with exercise before surgery are to perform the exercises only to your tolerance. We do not believe in no pain, no gain. If you find any of the exercises increase your pain or swelling, stop doing those exercises. A good way to judge how hard to push with the exercises or how many repetitions to perform is to remember a goal of safe but sore. It's okay to feel a little sore after exercise, but you should still be able to go about your daily activities. Assistive devices. You're going to want to practice walking with your assistive device before your surgery, whether it's a walker, crutches, or a cane. You're going to want to consider what modifications you should make to your home to improve the safety and reduce your risk of falling. You're going to want to remove throw rugs, pick up or clean hallways and your bedroom, and make sure electrical cords are out of the way. You will want to make sure that your walker or your cane is at the proper height. So the walker, when put next to you, and the cane should be up to your hip. And with the walker or the crutches, you should be able to maintain about a 30-degree or a slight bend in your elbow when the walker or the crutches or the cane are set up at the proper height. You will want to practice using these assistive devices on stairs in case you have stairs to get into your home, and if you have stairs inside your home to go from the first or second floor, along with practicing on level surfaces as well. Some of the keys for after surgery we refer to as rehabbing like a pro. Exercise and activity after surgery really focus on three main goals. The P is pain control and swelling management. Controlling your pain and swelling is key in the initial phase of recovery. The R is reducing your risk of blood clots and falls. Keeping the muscles gently working helps to pump blood and swelling out of the leg, reducing your risk for blood clots. Get up and walk every hour. Use your walker or other adaptive equipment in your home. O is optimizing your range of motion. Maximizing the amount of motion in your new knee during the first few weeks of surgery is your main priority, and walking, if you've had a total hip replacement, is your main priority. Exercise post-surgery. For people having a total knee replacement, your post-operative appointment will be scheduled prior to your surgery. You don't want to miss these appointments. They're very important. You will establish goals with your surgeon and your PT prior to surgery, and you're going to want to continue with PT until you reach your goals. Patients having a total hip replacement will want to develop a walking program and avoid extreme positions which your surgeon and your PT will go over with you. Walking safely. Use your assistive device until advised to stop by your therapist or surgeon. Using your assistive device properly helps prevent limping, pain, and swelling. Remember what your key goals are for after surgery. Reducing your pain, reducing your swelling, and optimizing your range of motion for knee patients and walking for hip patients. A review of your main rehabilitation goals after surgery. Ice and elevate the leg 5 to 6 times a day for 20 to 30 minutes a time, with an hour or so between sessions. Consider gentle massage of your thigh muscle, staying above or below the bandage or incision. Do not put any lotions or oils or vitamin E near the incision or bandage for at least 6 weeks. Walk a little every hour, gently tightening and releasing your leg muscles to pump out the swelling and blood throughout the day, and perform small, short sessions of your exercises during the day rather than performing them all at once. Focus on frequency. Keys for after surgery and some helpful pearls to remember. Remember your key goals and listen to your body. Recovery is about balancing exercise, activity, and rest. Often patients push too hard in the first 2 weeks and aggravate their symptoms. The first time you try something, go easy. If it goes well, go a little harder or do a little more next time. Overdoing it. This is a very common thing that people ask us, and something that does happen quite a bit. What happens to me if I overdo it? Asks patients. And we reply by saying recovery is not linear. You're going to have days that are good and days that are bad. Don't freak out over flare-ups. Everyone overdoes it. You can't harm your prosthesis, but you can slow down recovery for a day or so. You'll want to listen to your body and slow down for a day or so after and let yourself recover. And be patient. It's a process. Some of the resources we'd like you to watch are on the Concord Hospital and Concord Orthopedics websites. These are educational videos that discuss exercises, walking with assistive devices, comfort through ice and elevation, rest and activity, incision care, diet and nutrition, and tips to help with your recovery. If you have any questions before or after your surgery regarding your exercise program, please call Concord Hospital Rehabilitation Services, or you can call Concord Orthopedics. Thank you very much.